I chose to work at Mass General because of its reputation as one of the best academic medical centers in the world. I also chose Mass General because of the many opportunities to be involved in research and to help advance the field of breast imaging. In fact, Mass General is home to the largest hospital-based research program in the country.
We see a lot of cases, including complicated ones, not only from MGH but also from referring facilities. I think those are great training opportunities for us to see during a fellowship. We also have a lot of educational opportunities. We have radiology pathology conferences every day. We also have didactics by one of the faculties every Thursday. I think those are great educational opportunities for the fellows.
Trainees have the opportunity to develop skills in all aspects of breast imaging, including screening and diagnostic mammography, diagnostic breast ultrasound, breast MRI, and image-guided procedures, including biopsies and localizations.
I'm Dr. Deborah Monticello, and I am the Division Chief of Breast Imaging at Massachusetts General Hospital. We really focus on teaching here. We love teaching young people about breast imaging. It's a great specialty, has a huge impact on women, and we're very dedicated to educating them and giving them the best possible experience. And here we have a full experience, making sure that they get excellent teaching, they have good clinical skills, and there's also a lot of research opportunities. I mean, a fellowship's only a year long, but we have lots of small projects and larger projects that could use input for a year.
If you look at our geographic location, we are actually right next to the surgical clinic. So I think one of our strengths is this very easy access to our clinical colleagues. So it leads to a very comprehensive method of taking care of patients. If they have any clinical question, they come to us directly and we are able to take care of patients. And if we have a question, we can provide really streamlined care by just taking the patient over to the clinical side.
I really enjoy working with patients in breast imaging, and I do have the opportunities and great experience working at MGH with patients.
There's an abundance of research opportunities offered through the hospital, and particularly in the breast imaging division. We have several attendees with very strong research backgrounds, and there's a whole slew of projects to choose from, and they really welcome and encourage the trainees to participate in that research.
They are a great support system for us. I feel like I learn something new from them every day, and it is a great experience to share the fellowship with them.
The reason I chose MGH for my fellowship was great opportunities that I could have here in terms of research, excellent clinical training, and having access to mentors that would help me in my future career in academic radiology and breast imaging.
It combines the best elements that MGH and the Harvard Medical School ecosystem have to offer. They combine the best elements of a very busy clinical practice with the benefits of being in an academic environment of excellence.
We see the whole spectrum of breast imaging care here. We have access to cutting-edge technology, newer modalities.
You really learn how to dissect cases and make sure that we're recommending the right management.
I do think the quality of care here is the best I've seen.
Our mission is clinical care, education, and research. All three of these are equally valued. So we have very strong clinical staff. We work very hard to make sure the patients are having a wonderful experience. We are providing high-level care, but not at the cost of education. We make sure that the fellows' schedule is such that there's enough time for attendings to teach them. Fellows get plenty of cases that they can see on their own. They have a lot of access to attendings all the time for their education.
And we go back to 1978 when I founded the division. Back then it was called Zero Radiography. In those days we were debating should radiology be called imaging. But I decided that we were using more than just mammography, and in those days zero radiography, and we were doing ultrasound in those days. We started doing ultrasound, we were doing nuclear medicine studies and so on, and so I said I'm going to rename my division the Breast Imaging Division.
We have an outstanding faculty who is world-renowned, who is also devoted to teaching.
Boston is a terrific place to live because it's got big city attributes, but it's a small city. You can walk just about everywhere. So it's really a terrific city. The Museum of Fine Arts, Boston Symphony Hall. I mean, there's all kinds of arts and culture.
It's nice being near the water as well.
From Boston, you can go north to skiing, south to Cape Cod, which are beaches and sailing and swimming. And of course, you're right on the Charles River, and anyone who likes boating, there's boating on the Charles River.
It's a good opportunity to learn from different cultures, different backgrounds, and build relationship for a lifetime. So I'm depending on my co-fellows in the future.
There are just a lot of opportunities as trainees that we should experience and take advantage of.
It's an excellent program, and I have no regrets on choosing this program.
MGH is a very special place for a breast imaging fellowship, and we really hope you come join us.
One of the great things about MGH breast imaging is the history of allowing people to explore their interests. I think for a fellow, I can't think of a better place to come.